No, I see Mike. Well, if there's new folks, congratulations, you won. Looking forward to working with you as our local affiliate of state government. Our counties are so important. Services they're more efficient when they're administered close to the ground level. So we're thrilled to have 64 counties that are our state government units at the local level, and Weld is just remarkable in the innovation you've shown in transportation and land use and so many different areas. There's so many things to learn. We just announced today an award of about I think it was $2 million to UNC and Weld 6 school district. We're super excited about that through the RISE program, working with special needs preschoolers and kindergartners through the RISE funds. And we're very excited to work with Andy over there and Deidre at your school district. Just great folks. And I was also thrilled to see that RE6 is going to continue their in-person. We, as you know, we've lost a few districts doing that around the state here and there, and Greeley's been just solid in keeping the schools in session. And I just want to thank you for doing that. Not that that was you as commissioners, but that's your school board. We'll pass it along to them. So here we're talking about COVID. You know Weld County better than us. So, and every county commissioner knows their county better. So, I mean, the question is kind of what will work. Weld County, obviously the hospitals feed into some of the same hospitals that serve other parts of Colorado. They're seeing an enormous amount of traffic right now, sadly, increases from COVID patients. We have over 1,000 from across our state. We're not yet at capacity, but that's where it's headed if we don't take this intervention very seriously. That's why I think I put it publicly the other day. I said, Colorado, I love you. This is an intervention. We've got to figure things out here. It means people just socializing less with other households. It means avoiding groups. But what do we need to do in Weld County to avoid overwhelming hospitals is the question. I know Weld County doesn't want to be a burden to anybody, and you don't want to be in a position where you're sending folks to Larimer and Adams and Denver. And likewise, they are taking steps. These other communities, you've heard about many of the steps that other communities are taking, obviously, to make sure that they're not a burden to Weld. It's the darkest time in our country with regard to COVID, as you know, over 100,000 cases across the country sustained. Some experts predicted that could go to 200,000 a day, but even in the 100,000 plus range, very dangerous territory. Over 3,000 a day in Colorado, and over 1,000 hospitalizations. So, in hearing from your constituents, in understanding your constituents and understanding Weld County, we would love to know, in working with you, what's the best path to saving lives and getting the economy going in Weld County and preventing the pandemic from having a disproportionately negative impact on jobs and health in your county. Mike, you're on mute, and you got to unmute yourself for us to hear you. It happens to all of us. You're still on mute. Well, he's still on mute.
Okay, does that work better?
Yes, we got you. Go ahead.
Okay, sorry about that. We had it on the phone here in the room, Governor, and we thought we could just all use that phone instead of individually unmuting our Zoom. So we'll go with this way. So appreciate your comments as we started in this, and it's a good question. I mean, Weld County, we're seeing cases all over the place. I think we're continuing to do everything that Weld County can do to help slow the spread. I mean, our health department is working very hard with contact tracing. We continue to put messages out, and that's what we're doing in Weld County.
Well, I think unfortunately what is being done clearly isn't working. It's going the wrong way. But are there other ideas you have about outreach and changing behavior and just it's really more of a social and psychological challenge. How do we people know how to prevent the spread of the virus. I mean, they've been doing it successfully for many months in Colorado, including Weld County, but people are just sick and tired of it. I mean, I am, you are, we all are. So how do we know the vaccine's on the way? We know it's only a couple more months. How do we save Christmas? How do we save, lives? How do we do this in Weld County?
No, go ahead. This Commissioner Ross, thanks, Governor. Really, we believe here in Weld County, we're working within the confines that we legally are constrained to. We're doing everything we can. Recently, we've set up assistance for our contact tracers. We've set up the Sarah alert system so that our epidemiologists can have electronic notification go out to those that have been contacted and going through that positive case route, and we're helping them out so that we can monitor and diagnose their symptoms and their contacts and helping them that out. And it takes some pressure away from our epidemiology team and our contact tracers. Really, we are continuing to get out the message as well on our Facebook, social media sites. We also have town hall calls that we are doing monthly, reaching out to the residents of Weld County, and we continue to push that. We're still, though, believing that we're working within the constraints that we have legally to work within, and I think our residents are working in that manner. And unfortunately, this is a virus, and it's going to work its course, unfortunately, regardless of some of the steps anybody takes throughout this pandemic. That's my personal belief.
Are you do you currently have telecommuting for your county employees, and where are you with that?
We didn't hear the question.
Where are you with telecommuting for your county employees?
We do it when it's appropriate.
When is it appropriate?
When we follow the CDC guidelines, if there is a possibility of if they've been tested positive or if they're in near contact with people who have tested positive, we offer them the opportunity to telework.
Okay, so one of the things the state does, and this would be a great idea for Weld County, we are maximizing telecommuting, and that's obviously per CDC guidance as well. So we're at about 65% telecommuting. You have employees, we have employees that can't telecommute. Of course, we appreciate the work of your sheriff's deputies, of people who work for the county in the field. We have, CDOT folks who clear roads, and we have prison guards. But we want to make sure that everybody who can telecommute has the opportunity to do so. So, I think it's important to kind of send that message, right? Many private sector companies are at, 90% telecommuting, 95, 80, whatever they're at. Some are obviously less, and many, like Leprino, they have to go to work. They can't telecommute. Maybe some of the admin folks can. But really, it's about kind of modeling good behavior. That's one of the areas that we as public officials have focused on. How can we sort of practice what we preach, not just say companies would be good to do telecommuting, but say we're doing that. State does everything from running a lottery to processing your taxes to licensing liquor, and we're able to run this diverse enterprise of 30,000 employees at about 65% telecommuting. So that would be another thing the county could do to kind of model that, to show that you're taking it seriously, modeling the right kind of behavior. Obviously, first and foremost, keeping your county employees safe. We have obviously a great responsibility for our state workers, and you do for your county workers as well. So that might be some low-hanging fruit to be able to model as well.
We actually believe that we've set a good model for our employees and for businesses here. So we actually expect people to work and provide the services that are necessary for all of the other people that are within our county. So basically, for example, with Department of Human Services, they've been able to still do face-to-face services for people that need, the people that are most vulnerable that need those services. Unlike other counties along the Front Range, we've actually been doing a really very good job at setting a good model for how do we provide services to our employees. And I will tell you, Governor, some of the meetings that I've been on, this is Commissioner Kirkmeyer, some of the meetings that I've been on with your state employees, they've got a whole lot of activity going on in the background instead of focusing on the meeting that we're supposed to be at. So, we believe that we have been setting a good model. We have human services, health department services, public works, as you stated. We've got the correctional facilities with our jail. I mean, basically every single one of our employees we consider critical mission employees, and we expect them to provide services, and that we show to and demonstrate to our constituents that county government is open for business, and we're doing it in a safe and responsible manner.
That's great that you're being the role model and showing that, telecommuting can obviously work and is working for the county. As I said, there's jobs that can't telecommute, of course. If you're providing in-person services, we have those at the state level too that are in person. And maybe just highlighting that a bit more to kind of show, I think a lot of private sector employers kind of look towards you as a role model, and I think that, and it's good that you're taking that role seriously and encouraging kind of safety at the workplace.
Okay. Governor, I wanted to compliment Weld County. We at the Department of Public Health and Environment look at your rates of disease transmission daily, not yours, but every county in the state. And we've been working off of this dial framework. And so I think, we have counties classified, and then we have the recommended, restrictions or how open a county can be based on their transmission rate. And for months and months and months, Weld County held pretty steady, and you were much lower than other counties. And I know one of the reasons is you have a really sophisticated public health department that we work with often. I think, one of the messages today is that we're sounding the alarm at the case increase around the state, and around the state, we have the capacity to contact trace between 500 and 1,000 cases a day. And now we're up to over 3,000 cases a day. And so all of our public health agencies are having to prioritize who we contact trace. And so that's one tool that's become less effective. And as that happens, then we have to rely on our dial more and trying to have people give the message to people that we want them to reduce their interactions. And we're asking people to reduce their interactions during the month of November. There's a state order to only interact with one other household, but we'd actually love for people to go further on their own and just not be interacting with other households. We see transmission really occurring within people's houses. And you know how it is, you have friends over, you have family over, you let down your guard, you take your mask off to share a meal. I mean, I do it. It's a hard thing not to do, but that's where we're really seeing transmission. So we're talking to counties about movement on the dial that puts in additional restrictions. But Governor Polis says all the time, it's about winning hearts and minds. It's about psychology. I mean, we don't know what people do in their own homes. So these measures only go so far. And we would just love leadership amplifying. We all need to pull together this month and reduce our interactions. Basically, it's a personal behavior thing, really. And we all have choices. We don't have the COVID police running around giving people tickets for this or anything. We're really sort of all on our honor system. So if there's a way you could amplify that, because our contact tracing there's too many cases and you can't really tell where outbreaks are because there's so much widespread community transmission that we don't know, is it happening within this restaurant or did two workers get it somewhere else and bring it in the restaurant? They're not even connected. So.
And what we're concerned about is hospital capacity. And I encourage you to talk to your hospitals and they'll share with you what they're experiencing. They're not there yet, but unaltered, that we're just a few weeks from there if the trajectory doesn't change. Now we have a little bit more, right? We have some extra beds in convention center. But what the danger is not just for people who contract COVID, by the way. I mean, because people might think, oh, if you get COVID, it's your own fault because you're not wearing a mask or you're not social distancing. But it's the same hospital beds that we need for heart attacks, for strokes, for appendicitis, for car crash, for trauma, for everything. That we don't want to have to sacrifice that life-saving care that can be provided in Colorado thanks to modern medical technology, whether it's COVID or non-COVID. So just keep that in mind. They're sort of the same beds that go for COVID and non-COVID. And right now, COVID has over 1,000, which we have room for. We're at way higher than normal occupancy rates. We still have room for trauma and heart attack and all that stuff. There's some systems that have eased up on some of their elective stuff during this crisis. Now, they did in March and April. They're doing it again, some of them to free up the beds. But generally speaking, we are getting very close to this red line where, if you get a heart attack, you get a stroke, you won't get that same quality of care. And of course, COVID as well. We know survivor rates go down when they have the care that isn't at the same level. There's been great breakthroughs in care. we are blessed by having wonderful development in this area. Essentially, at the start of the crisis, we lost about 20% of the people that entered the hospital from COVID died in Colorado. Now we're at about 5% fatality rate for people who enter the hospital. So it's gone down a lot. Now, 1 in 20, but still, I lost a good dear friend who was hospitalized for COVID, and she passed away four days later. So, 1 in 20 is little consolation to those who've lost a loved one from this virus. But and the hospital stays are a little shorter. We've gone down from 5 days to about 3.5 days average. So those work in our favor, but we still, even with the shorter stays, we still filled up over 1,000 beds. Thank goodness for shorter stays. We'd probably be at 1,400 beds if the average stay was 5 days like it was at the start. But there's some better therapies now, so we're down to 1,000, but that's still 1,000 beds. And so our real concern is, how do we turn this around? How does Weld County lead the way, and really inspire the rest of the state and protecting lives and preventing hospitals from being over capacity?
Governor, this is Commissioner Ross again. I was wondering maybe if you could walk through that decision-making process that you went through as you stood down. For us, it'd be the ranch or the Budweiser Center up here, where we had that in place with the extra, I believe, 250 beds should our hospitals get overrun in their capacity. And maybe you could walk through that process of standing that down here this fall, where we won't have access to that. So
yeah, sure. The main concern that we have are ICU beds. Those were non-ICU beds. We could very well have some increase in the non-ICU bed side. We feel comfortable with the 2,000 capacity for the state. We also have 2 smaller centers in different parts of the state. The ICU piece has surged from March. That's why we're not shut down now. It's why we're going about life. It's because we have a lot more capacity than we had on the ICU front than we did in March and April. The hospitals built that. But we do not have the ability to build ICU level care outside of hospitals. That's something the hospitals have had to do. We were taking the non-ICU side, and we have that capacity. And we hope we never have to use it, but that's getting very close to when the first of those facilities might need to be opened.
Sure, but Governor, we aren't hearing from our hospitals that they're even anywhere near capacity or that they're being overwhelmed. And so that's when we entered into this in a voluntary basis with you all the way back in March. The whole idea was to flatten the curve and to spread out the occurrence of people going into the hospital and ensuring that the hospitals didn't become overwhelmed. So again, we're a little bit confused as to why an alternate care facility was demobilized in September, close to the end of September, and then now we're being told that the hospitals are reaching capacity. Well, we aren't hearing that from our hospitals, and we check all of the hospitals within the Northern Colorado region to make that determination because of our counties being so large. So I guess we're not hearing that from our hospitals, that they're overwhelmed or that they at this point are concerned with their capacity. In fact, they're more concerned with being able to stay open and being able to provide service to the people in Colorado, quite frankly.
That's great. So that's welcome news, and we encourage you to have those conversations with your hospitals. And obviously, if they're not facing capacity, then it's less of a worry. As a group, they've come to us and are very concerned. So we're happy to kind of drill down on the Northern Colorado and Banner and some of the other providers. But they have sounded the alarm bells with us, which is why we're reaching out to you. But we're happy to make sure that we can have that discussion together. But that would obviously be welcome news if they're not approaching their capacity limits in Weld County.
Well, I think it would be good. Our lines of communications with the hospitals have never been closed down or shut down, so I'm not sure why they aren't sounding the alarms with us, but they aren't. And we check our daily hospitalization rates daily so that we know what's going on. So, and again, even with regard to the ventilators and stuff, at one point, Banner Hospital returned ventilators. I mean, at one point you were saying that we were going to need 9,000 or 10,000 ventilators, and we never even got over 400.
We're not concerned about ventilators. We are, the biggest concern is around staffing. Frankly, for a surge, and then secondly,
they shouldn't have furloughed their people.
What's that?
I said they furloughed their people and they haven't ever brought them back because they're having issues now with basically running their hospital with what occurred over the last 6 months.
So it sounds like they're having staffing issues as well. Yeah, that's our top concern on the surge, and then as I said, beds are the second concern. We are not concerned about ventilators.
Well, that's good. Well, and the hospitals have not, basically, like I said, have not demonstrated or picked up the phone to call us and tell us that we need to sound the alarms. In fact, again, we look at the hospital rates, and I think yesterday we were at 56% of capacity, and that there are still plenty of ICU beds available. So that's
wonderful news, because as you said, I think making sure that you position Weld County not to be a burden on the rest of the state is really critical. And there are areas of our state where they are very close to capacity. And obviously that could be yours if it goes up. But I'm glad that you have no barriers to that communication. I would suggest weekly updates with your weekly calls, maybe with the commissioners and your major hospitals, including in Northern Colorado, I think would be a great step.
Well, in fact, Banner is, they've struck a deal with their other hospitals around the region. They're sending all their patients here to Greeley's NCMC hospital from all the regional Banner hospitals. That's our understanding, at least as of most recent update and phone call that we had with them. And that's to keep the virus spread isolated in one hospital so they don't have cross-contamination inside their other.
That's smart. And the other area we've made tremendous progress the last 6 months has been in supplies, because you might recall another thing the hospitals were screaming about in March and April is we're out of masks, we're out of gloves, so we have to use them for 4 days, the same mask. It increases risk of exposure for healthcare workers. They have increased their own supply chain, and we augment that where necessary. We have a stockpile now of several million masks that are available for hospitals, so that frontline workers, healthcare workers, aren't asked to, take a risk beyond the normal risk they take every day. But it's unfair to say you're wearing a subpar mask or you have to, against the rated use the same one all week. So we've made great progress on that. It doesn't mean healthcare workers won't contract COVID at their workplace, but we feel better about them having the best supplies that they need to reduce that risk. And it sounds like Banner is taking an extra step of taking extra precautions and focusing contagious COVID in a certain hospital and ward. Many hospitals do this by ward. They don't do it in different buildings, but they have a COVID ward, non-COVID ward. But yes, you can also do it across different buildings if you can do that. So, and we talk every week with the hospitals as well. Banner's usually on those calls. But how you can isolate COVID patients who are contagious is a best practice that all the hospitals are super engaged on right now. So I'm glad to hear that Banner's implemented that in a good way.
Governor and Director Ryan, Mr. James, I certainly appreciate your time this afternoon, the opportunity to chat with you. Governor and Director Ryan, I certainly commend you on your dial format and on the metrics and the guidelines that you stood up with that. I appreciate it. I'm a big fan of data as well. Might I make this suggestion with data, in that we are focusing on flattening the curve, we are focusing on keeping our hospitals from being overwhelmed. Could we make the metrics that we consider in your dial format more hospital-based and more asset-based, what goes along with the hospitals, and less about case counts? Because I think the virus does what the virus does, and sooner or later we're all going to come in contact with it to some degree. So I think if the dial format were to more focus on the metrics that drives that hospital care, that would be appreciated. Secondly, I agree with you, Governor. I think it's about winning hearts and minds. I think it's about encouraging people to exercise their personal responsibility to make the choices that are right for themselves, their communities, their families, and their neighborhoods. And so we'll continue to join with you on making sure that we reinforce the messages about the severity of the situation and on the actions that they should properly take. So thank you for entrusting the people of Weld County to make the decisions that are right for themselves.
Yeah, and ultimately, this is a matter of individual responsibility. I mean, it's on us as public officials to do two things, and one is the testing surge, and you've been a great partner in that, and the other is the hospital surge, and that's largely private, some public, but it's working with the privates to do it. So those two things are on us. But the biggest part is just on people. It's about individual responsibility, as you indicated. We do have, I think hospitalizations are one of the three indicators on the dial. So it's absolutely looked at. And you're right. I mean, case counts are very different if it's people in their 20s or people in their 60s, right? Now, this was somewhat, harrowing for me to see this number starkly. But right now, the biggest group of people hospitalized are 40 to 64. There's just more of them, and they have a lower hospitalization rate. But there are more people in our hospitals today, 40 to 64, than there are 65 plus. Maybe it's the additional precautions people 65 plus are taking, but this is deadly to people of all ages, obviously less deadly for people in their teens and 20s significantly. And then you get up to my age, 40s, and it's better outcomes, but the hospitalization rate still remains the largest single group is in that kind of middle age range. But you're right. I mean, the trajectory of the hospitalization piece depends on who's getting it. So if it's 20-somethings and teens, it is a much lower hospitalization rate than a senior living facility where 1 in 4, 1 in 6 could be hospitalized. It's just devastating at many of those centers that have been affected directly in Colorado, and obviously some don't make it out. Some do and some don't. But that's a good point, and I think as elected officials, all of us need to just echo that theme of individual responsibility. I mean, you all have soapboxes, you're trusted public officials. We're making the right choices, informing people with the data they need to make the right choices for them and their families.
So on that note, and thank you so much, Governor Polis, and I definitely, if Director Ryan has any remarks as well, but we are quite near time. Due to where cases are, we are watching Weld County and what's going on in terms of elevation of case rates and hospitalizations. We've heard Larimer County has about 20% of their hospital capacity is actually filled with Weld County residents at this time, and so they're watching it very closely as well. Director Ryan, do you want to make any more comments?
Yeah, really quickly, you're not the only county to say, why don't you use hospitalizations as the dial metric? And I mean, it is a fair point, because that's when you're really in trouble. The only thing is, the hospitalizations is such a lagging metric. It's really because COVID gets into exponential growth really easily, and because of the asymptomatic nature of it, where people are walking around spreading it for 14 days and we don't know, our early indicator that we need to start putting restrictions into place so that people have less interactions with each other is really the rate per 100,000. And if you wait for hospitalizations, by that point you have to put in way more restrictive measures for way longer. Which is why we use the incidence as the leading indicator and try to get it under control and get it to plateau so that we can start to open again and not have to have, restrictions for a long period of time that sort of, crush the small businesses and are really hard on everyone.
Maybe what we can do, so we're just operating on the same page with hospital data in Northern Colorado, is do a follow-up call, Jill. I don't need to be on it, but let's do, you and the commissioners and maybe Casey from my team with Banner, any other providers, the one that really just sold, and let's just, get an update from them, Thursday or Friday, where they're at, the trends they're seeing, just so we're hearing the same thing the commissioners are seeing and are on the same page. I think that would be very helpful.
Yep, happy to.
And thank you, commissioners, and we'll look forward to continuing to work with you, leading the way in Weld County in so many ways, and hopefully leading the way on combating this deadly virus. Thank you.
All right, thank you.
Yep, thank you.